Hello, I'm Dominic Kennerson, Global Head of G4A Digital Health Partnerships at Bayer Pharmaceuticals. Now, I'm quite pleased to welcome Bakul Patel, who recently joined the team at Google Health for Global Digital Health Strategy and Regulatory. And of course, many of us know Bakul for his work at the U.S. Food and Drug Administration, or FDA, where he served as the Chief Digital Health Officer of Global Strategy and Innovation. Bakul's esteemed career includes highlights such as working with international regulators to create the term software as a medical device, or SAMD, to developing the FDA's pre-certification program, and of course, he was at the vanguard for launching the FDA's Digital Health Center of Excellence. Now, Bakul, we are really quite excited about your new role at Google Health. Yet, in this fireside chat, we would like to tap into your wisdom after a successful career with the US FDA.
Well, first of all, thank you for having me here, Dom. I think this is really fantastic opportunity for me as well as to share my thoughts with the audience. Um, my career has been very serendipitous, as you sort of pointed out, but also very satisfying. I was always leading technology-driven sort of aspects, and I would say my last 13 years at FTA has been the most satisfying. I finally was trying to figure out, how can I serve the people of the U.S. Being the role at FTA to the fullest. And I think that to me, when I realized that in the first few years of my journey at FTA, it really became the North Star for me. Is the people in the U.S. and the population of the world, and the service that I could provide through through what I knew best is creating the right strategy for FDA to be relevant, building an infrastructure for FDA, not just the program, but also the people that I brought in to help with setting up the program, and then changing the mindset for how we should look at products that are going to be in front of FDA down the road, not just now, but also in the future. Is really, I felt like, I was able to contribute a little bit to the community and the society.
That's awesome. And infrastructure inside of a government agency, from an outsider's view, outside looking in, I imagine that can be a complex process. I'm quite curious. We all know that the FDA Digital Health Center for Excellence launched in 2020. And I think I'm really curious to know, how did that come to fruition? Did you have the right structure in place at the right time? We also know that 2020 was a very important moment for the entire world. Was it a perfect storm kind of scenario? What really happened there to make that milestone in 2020?
Yeah, I don't think it was an event that sort of marked the creation of the Center of Excellence. I think it was an evolution, and it's an organic growth for the organization for sure. I think this journey started way in 2015, 2013 when we started looking at how technology was evolving, and then when we had the commissioner Scott Gottlieb there. I think at that point, I think this concept of having a center of excellence does envision to provide service to the entire sort of FTA, where we're building a cadre of people, having a cadre of people with the knowledge of this technology, this impact of this technology, the intentions of where things are going, and keeping an eye on the future became sort of important. So it was actually a process, as you can imagine. In the government, it's nothing happens overnight. So um, we had to propose the concept to Congress in one of the budget proposals in 2016. We got the okay from the government, from Congress, to sort of establish a center. This was back in 2017. So you can imagine it took a time for us to even get the green light to go build something, and it took us a little bit because we were not sitting idle, and I think the team was busy producing policy documents. So we had to build in parallel with all the work we were already doing. When we were poised to launch in 2019, but you can see, I mean, the beginnings of the pandemic had started to happen late 2019, early 2020, and hence sort of it got pushed to later 2020. because I think that's the time we had a little bit of breathing room to actually establish the center and launch it. So it was rather a journey, I would say, as opposed to an event that was designed to be that way.
That's awesome. And it's interesting that you talk about this congressional process, because I actually read an article recently in the Regulatory Affairs Professional Society, and I thought the headline was so interesting. It was definitely attention grabbing. And the headline says pre-cert needs new legislative authorities. And I thought that was interesting because to me, I was wondering, well, what would that authority entail? Are we thinking about something that's outside of FDA? So would it make more sense, for example, to just build a new digital regulatory body from the ground up, instead of trying to work on an existing structure?
Yeah, I think that article that you're mentioning, I think referred to the concept we were pursuing at the Center of Excellence on the pre-certification program for software. And it was really a brainchild that I'd come up with in 2016 to start thinking about how can we, parallel some of the experiences that we have today in other parts of our lives, right? So when we go to the airport and we have either a TSA pre-check, we have a check, but it's a different experience level once you're willing to share information with the government, right? So I think, but if you take that concept and you do it for software or software like products at FDA, you can imagine openly sharing lots more information in the background that doesn't create friction between the sharing part and the consuming part of the information. Would could lead to a better experience for products to go to market. So I think that was a concept we did. Another similar parallel I think you would imagine is the credit score that we all have in the US for sure, where you get certain credit for being certain, good credit citizen. And based on that, you are availed certain you know flexibilities in your purchasing power. If you take those two concepts, I think those are the genesis of what we consider pre-cert to be. So I don't think it is less of a question of whether it should be outside of FDA or not. It's more of a question about how can regulations be more nimble. Now, how can oversight actually can regulations has a bad connotation, right? So if you think about regulations as, oh, it has to be meeting these standards, I guess I guess what we are trying to change the narrative to is, can you be excellent and can you provide that data transparently to an oversight body such as FDA, who has the remit to assure that products are going to be safe and continue to be safe in the marketplace. So that's sort of the intent. Now, does it fit squarely into our current sort of authorities and current sort of way of doing things? I think the process part of what we have implemented at FDA in the US, maybe slightly different than what we are intending to sort of do and how the technology is evolving. So I think the article basically, if I'm referring it into the right article, I think it was basically saying that, in order to have some dramatic changes in how we look at these emerging technologies that is emerging right in front of our eyes, we need some emerging solutions in our authorities as well for an organization such as FDA to oversee them.
Hmm. I think it's interesting when you talk about software developers or digital health companies going to a body like the FDA to go through pre-certification for their software or for an SAMD. What we know is that most early companies don't have such infrastructure, and they don't really know where to start. Um, what would be your ideas for changing, I think, this fundamental situation in healthcare companies, especially early healthcare companies, where they don't have an in-house regulatory resource?
Yeah. So let me put it really simply, right? Regulatory affairs people and regulatory infrastructure that exists in either medical device or drug companies, they're basically translators between makers of products to the regulators. And And if you think about it from that perspective, not a single organization I have come across that gets up in the morning and says, I want to do bad for the public or bad for the patient. And so what comes from there is good organizational behavior, good engineering practices, good manufacturing practices. I think every company strives for that. Every company that I've come across at least strives for that. I've not come across anybody who doesn't strive for that. So I think then the question is, okay, if everybody's striving for that, is the intentions of the government and the regulations is reflective of what people are striving for, or is it congruent with that? And the answer is yes, right? The government and the regulations wants best products to be out. The companies who are making products wants best products to be out for the hitting the best sort of ability for patients to sort of access to. So now the question becomes is how do regulatory affairs people translate that to the regulators, what the company is doing. So I don't buy it for 1 second, even however small a company is, don't have the people who are able to translate it readily, let's just say readily, but they don't have good infrastructure and good organization, good intentions, good practices in place, right? Now, there might be gaps in terms of what people see good means versus what people see is okay means, and so on. So I
Right.
think it sort of behooves a government or regulator to be transparent of their expectations. So, and then it behooves a company to be speaking the same language to those expectations. And I think
Right.
that does not necessarily require you to sort of have a specialized regulatory affairs um, group that can sort of do that. So I think that's one of the things we were trying to do in pre-certification program is to close this gap of translation, close this gap between how it's done to what's been said about it, how it's done. And it would probably make the regulatory affairs group's job really really easy, but at the same time get closer and closer to the reality. And it creates two options, right? And it creates one is it becomes really transparent. The organization becomes transparent to regulators, and the regulators become transparent to the organization, and hence you have a better flow of systems.
Translation, transparency. I think there's another T in there. And I'm thinking about actually, trust is definitely part, but I'm really thinking about the T related to time and temporal space because the traditional tracks, so to say, inside of the FDA are really made for biopharmaceuticals. And so to transform that, or you can't really, I imagine it's difficult to apply that to a digital health company. And what we know from SAMD is that there may be requirements to connect with a body like the FDA in a shorter time period. So a company like Bayer may have to report, you know, on the horizon of years, whereas a digital health company may have to report updates weeks, months. How do you, I think, um, uh, I guess, balance that equation for time inside of a body like the FDA when it comes to the temporal space or the time?
Yeah, so I think it's a good old sampling theory, right? I think if you look at if things are moving quickly, then you need to sample quicker. If things are moving slowly, you need to sample, at a much longer interval, right? So that's kind of really what it comes down to. So if you want to understand like how an organization is behaving, how a product is behaving, I mean, it has to scale. And that is one of the factors that the article probably refers to is our timelines and expectations of when reporting requirements cannot be one size fit all. It has to be tailored with with either the times of where the methodologies have evolved, or it could be based on the size or the product type area that matters. Because you can imagine a pharmaceutical company may not have a product evolving every week for some, but a software company certainly will probably see iterations and evolution of their products based on live customer feedback evolve over time, real quickly, much more quickly than many years that happens for a pharmaceutical company to sort of shift and evolve, right? So I think it has to be fit for purpose. It has to be right sized to get the timing right. Otherwise, what will happen is it'll be too burdensome for one and the totally meaningless for the other side of the equation.
Right. So also in the concept of time, you've also shared some history lessons with us from your early days and at the FDA. And so 13-year career, this goes back to the Affordable Care Act days. And I think that's super interesting because we know when that started to roll out in the United States, at least on the technology side and the health IT side, one of the challenges was EMR, EHR adoption amongst providers. And I'm quite curious, and to also take the conversation globally, what lessons can we learn from maybe that rollout or from maybe those nuances in provider adoption? And I'm thinking especially in the context of Germany's digital prescription law and rule, which, I mean, I think we understand why digital is so important. Everyone from Jane Doe to healthcare providers understand it. But when it comes to providers, what role do they play in really adopting digital technology?
I can tell you the Affordable Care. I mean, thanks for bringing up memories. I think Affordable Care Act was a really interesting era and I would say it was a really bold move on part of the government to kickstart a journey for the adoption. It's a change management from some aspects, right? I mean, you can imagine there are lots of doctors who are just keeping paper files. Some are keeping Excel spreadsheets, and there it was their poor man's way of looking at EMRs to some degree, right? Some are just using Outlook for managing their visits and so on and so forth, right? But I think the push and the pull that happened with the Affordable Care Act that incentivized people to use technology to manage their patient records, which also kickstarted an entire industry to create records, right? So I think to create record systems that can be used. So we're not out of that kickstart process that have created sort of this snowball effect, right? Which probably unleashed a tremendous amount of information to the world that can then be longitudinally sort of mined for as we start looking at data being collected from all individuals across the healthcare system. So I can tell you, like, that was brilliant in terms of what a government can do, and I think that's what governments should do. Is when there is resistance in the marketplace, and there's a resistance in the people using some things that could be down the road strategically avoidable, or people would avoid that. I think this is where government's role in sort of instilling this behavior is probably going to be much more helpful. And I feel like, I mean, to your point about, how important it is to have government step in and sort of create this ecosystem for digital health, and how providers can play a role. I think it starts from the government. It starts from educational institutions like the doctors, the new clinicians that are being made, either let it be nurses or primary care physicians or specialists. We all need to start educating them, sort of the how to trust, where to trust, when to trust technology, and sort of translate that into practice as they come across. We should never forget the people who are already practicing, right? Because we need to have that education as well, to those practitioners. But on the flip side, I think we need to bring products that are trustworthy to the marketplace as well, and the government can play a role to sort of arbitrate between how do we sort of figure out where is trust, what's the expectation is, and sort of have a true learning health system.
So it sounds like CME a little bit.
Could be. Yeah.
So I'm curious, you actually said something about products and trusting products. And I have read some information out there about the way that you potentially may see the marketplace. And I think it says something along the lines of you want to be able to play a role in guiding people and making the right investments and helping meaningful solutions come to the marketplace. And we know that the marketplace has been, uh, for lack of better words, white hot the last 2 years, so 100% year over year in the venture funding space, 2020 and 2021. So, how do you see that unfolding in 2022 without being too speculative? Or maybe a better question is, what role can you play in that?
Well, I think I see myself as like the biggest proponent of evidence-based solutions, and I think it comes with that perspective of, if we're gonna see healthcare turn into digital healthcare, which will turn back to regular healthcare because we will probably drop the word digital down the road. Um, and the question is, how do we sort of transition into that space, so that it actually can become that? So that's sort of the North Star and the goal that we all should have, right? So I think, you know, uh, plus we also know there's lots of inefficiencies in our current healthcare. So solutions that drive down inefficiencies or drive up efficiencies are great investments, right? Solutions that actually, what I'm really interested in, how do you bring this phenomenal power of technology and data and information, insights that is now totally feasible through software, to really detect the onset of a condition or a disease before it actually shows up as symptoms. That's really what I really want to see happen. Because you can imagine what happens next, right? Easily. Your interventions will be smaller. Your clinicians have so much time to change the course of a disease or a condition, and you probably end up with smaller side effects. So I think the advantage of like front loading or front identifying is going to be sort of where I would like to spend some time focusing on trying to get people to sort of those technologies that can be available. I would say that in the process, I think we also should probably think about the masses, that are already, um, can or have the potential to be touched with some of the solutions that are out there, as opposed to just the ones that come to a clinic, right? I think we know pretty much in the world, not everybody is able to go to a clinic and see a doctor. So how do we take care to a patient where they are is really, really sort of what I've been sort of evangelizing for a bit.
Well, I think that's something most of us can ascribe to, especially when we talk about inefficiencies and building efficiencies on the front end. I mean, it only makes sense, especially when you talk about dropping the digital on digital healthcare, because it should just be healthcare the
Yep.
same way we talk about banking, right? No one says digital banking. It's just how you bank. I feel like we could continue for another hour. Uh, so maybe we can take this offline at some point. But I think, in terms of the audience and the time we have available today, maybe I can just ask you one more question. And it's a question that I borrowed actually from the people at MedTech World, and I thought it was super insightful because they ask, if you had one wish for digital health, what would it be and why?
Well, let me like roll back my my thinking and say, and just talk about where I would like to see. I would love for people to start creating solutions for for those who can't really afford healthcare. That would be my biggest ask. I think if you start focusing towards those people, I think you solve a whole bunch of issues that exist in the world today from an equity perspective, access to healthcare perspective, and really it solves even some of the commercial problems that we see today. Is if you focus only to the ones that are in the urban areas, then you only get the urban market. But
Right.
if you now start focusing to the world, I think you probably get the world market to be expanded. So I think that's how I would frame it.
It's excellent. Thank you, Bakul. Really appreciate your time today.